Hi, I'm Lindsey Douglas. I'm a pediatrician at Mount Sinai Kravis Children's Hospital in New York City, and I'm also the medical director of quality and safety for the Children's Hospital. So we're really excited that the vaccine has been approved for children 6 months to 5 years of age. It includes now nearly all children. And the reasons that we recommend giving the shot are really threefold. The first is the vaccine does in fact reduce the chances that a child will get COVID in the first place. Now, a lot of people have looked at the numbers and thought, well, the reduction doesn't seem to be that much. However, the second reason is we know that it reduces the chances that a child will get severe COVID. And that is really important. Children being hospitalized with COVID is something that we're really quite worried about. And we know that vaccines improve that. And the third is truly getting us back to normal. Children being able to be around other children, being able to be around their grandparents, and reducing the risks of transmission in general, and getting us back to where we were hopefully before, that we can all gather together and not be as worried about COVID. Well, we have some information about both of them. Of course, there were studies that were done for the approvals for the Federal Drug Administration, the FDA. They seem to have similar efficacy. However, the doses are different and the timing is different. There's 3 doses for the Pfizer and there's 2 doses for the Moderna brand. My recommendation is get the one that's easiest for you to get, that's available at your pediatrician. The differences are probably not as important as the difference between having the vaccine and not having the vaccine. So the side effects have been quite minimal, and they're similar to other vaccines, which include soreness at the site of the shot. But you can get some mild symptoms as well. I like to think of these as proof that the vaccine is working. So things like fever, muscle aches, it means that your immune system is actually activated and working. I myself had a lot of these quote unquote side effects after getting the vaccines myself. And one of my really brilliant colleagues, who's an infectious disease doctor, said, well, if this is what it's like for you just with the vaccine, imagine what it would have been like if you had gotten COVID directly. So I think that's a really helpful way to think about this, that the side effects show that you're fighting against the RNA that's in the vaccine, but it shows you also that your immune system is working and that you're activated, and it's a good thing to get some of these side effects. The effectiveness of the vaccine was shown in how often a child would get COVID. As I mentioned before, that's only one thing that we're really worried about is getting COVID. The other thing that I really worry about, as I'm a pediatrician who takes care of hospitalized children, is thinking about the vaccine preventing severe disease. And that is not something that they looked at as carefully. So I think that's something that each parent should think about. Preventing severe disease in children is really important, and so is getting back to school and play groups and all of the things that smaller children need for their development. Those, to me, are equally as important as not getting it at all. So a lot of people talk about the fact that children don't get COVID or had less COVID, and that technically is true. There were more adults and have been more adults who have gotten COVID. There are more adults who are hospitalized with it. However, there have been deaths, children who have died from COVID. In my opinion, this vaccine prevents both serious disease, hospitalization of a child, and a child dying from COVID. That alone is enough to vaccinate your child. Well, the studies were done in children over 6 months of age because the immune system is more primed at that time. We do start shots in infants as early as 2 months of age, but many of them can't be given until later and older, including, for instance, the chickenpox shot, which is not given until a year of age. There was some thought that it wouldn't be as effective in those younger ages, and people tend to be much more careful with children under 6 months of age because it's quite known that the immune system is not fully formed at that time. So, unfortunately, getting COVID doesn't prevent you from getting it again. And so, yes, I would recommend even a child who has had COVID-19 be vaccinated. We know that vaccination is a strong way to prevent disease and prevent severe disease. And having some natural immunity from having the disease itself also is, but the combination of the two is like a superpower. And so I would definitely recommend, even having gotten COVID, that people consider and strongly consider vaccinating their children. So the only other thing that I would say is the vaccine has been out for quite some time now. There's no reason to think that a 4-year-old is all that different than a 5-year-old. And as a pediatrician and as a parent myself, I'm thrilled that we can offer the vaccine to our most vulnerable and youngest children. This age group has been out of school the most of any age group because of not being eligible for the vaccine and not being able to wear masks as easily because of developmentally normal age would make you want to take off your mask when you're 2 years old. So the only thing that I would say is run, don't walk to your pediatrician and consider getting your child vaccinated today.